Okay, guys, it's 11 o'clock, so I'm going to go ahead and get started. Can everyone hear me okay?
Yeah.
Okay, just want to make sure because sometimes I hit my button on accident. Okay, so I'm just going to go over chapter 19 and we'll call it a day after that. The chapter 19 that I put on Canvas for you is going to look a teeny bit different than what I'm going over with here, but not too much. It's fine. So the important things that you need to know you'll have in here, so don't even worry about the differences. So this Paula Winters lady from Wisconsin, she's the one who has been helping me, giving me some stuff for the class, and she changed the PowerPoint, which I didn't realize how much she changed it until a few minutes ago, but it's okay, it's fine. So I'm just going to use hers because she has some extra stuff in here that I think is kind of good. So you can still follow along with what you have. There's just going to be certain things that she cut out of it, and that's okay. All right, so chapter 19 is talking about alterations in women's health. Um, so there's all kinds of different women's health problems out there. You know, we could, if we really made a huge list, we could talk about things like, you know, breast cancer and polycystic ovarian syndrome. There's, all these different things. So we can't hit everything, of course. So we're just going to hit a couple of things in this PowerPoint and we'll kind of go from there. So she talks about polycystic ovarian syndrome. I don't know if any of you guys knows anyone who has this, but it's kind of a common thing. There's a lot of people out there that have this. So what this is, it's a menstrual disorder that causes you to have frequent or prolonged menstrual periods or excess androgen levels. So your ovaries can develop numerous small collections of fluid and fail to regularly release eggs when you have this. So like if you had this syndrome and you were trying to get pregnant, you might have a really hard time. So they diagnose this usually by doing like a sonogram of the ovaries. They'll be able to see the cysts on them by that. Um, Usually this is going to impact 10% of childbearing women. So some of the causes for this, some of the things that I was reading about was excess insulin, low-grade inflammation. It can be hereditary, so it can be passed down from your relatives, and then also that excess androgen. So signs that you would have this, of course you're going to have those differences with your period. So like you could have like really heavy periods that last forever, or you could have like really irregular ones. And then other things, if you have that elevated androgen level, it can cause excess facial or body hair, sometimes severe acne. um, and then also, like if you were looking at their ovaries may be enlarged and contain those fluid-filled um, areas that are causing problems. So with your symptoms, they can develop early or they can develop later. And sometimes they're in response to weight gain. So if this person is overweight, that's not a good thing. With this, again, you can have trouble getting pregnant. So if you had this, you definitely want to get it treated so that you don't have that problem. You can always have problems with miscarriage as well when you have this, and then also preterm birth. So what they do for this is they basically kind of treat the symptoms. So some things would be like progestin therapy. A lot of people are on like fertility meds, like Clomid or Femara. Some people take glucophage. And then there's also birth control pills that sometimes they'll put you on. It just depends on your symptoms and what they're treating. She has this is like a concept map of this. So again, someone who has polycystic ovarian syndrome is going to have, problems with their menstruation. They're going to have too much of that androgen. They usually are obese, and a lot of times they have pelvic pain that goes along with this. So this just talks about different risks and things that you can see going along with this. As far as like nursing diagnoses, chronic pain would be part of this, knowledge deficit, and then disturbed body image because of the different problems with facial hair. This slide is just talking about some of the symptoms. Again, this goes into things like having trouble conceiving, acne, insulin resistance, high testosterone levels, low sex drive, irregular periods, ovarian cysts, you name it. This picture here is supposed to be like, I think she said it was a cross section of the ovaries. So like on the left, you see what a normal ovary is supposed to look like. And, if you like split it in half, you're supposed to see, like eggs and stuff in there. The large cyst over here, on the right side, it's showing this polycystic problem where you have all of these fluid-filled spots inside the ovaries. So you still might have some eggs in there, but not going to be as many. And all of these cysts are causing these issues. Okay, so difficult to treat pain is characteristic of which of the following conditions? This is going to be what we just talked about, polycystic ovarian syndrome. All right, and then she gets into a little bit about sexually transmitted diseases. I know you guys have talked about that before, I think back in Adult Health 1. Of course, these are transmitted through intercourse, oral sex, and anal sex too. Treatments are going to be different depending on which sexually transmitted disease a person has. You can get complications if you don't get treated from these. Like just think about syphilis. Syphilis used to be really big back years ago. And if that doesn't get treated, you can actually lose your vision and have all kinds of, bad things happen. And then, of course, there's some of these diseases will actually go unnoticed for a long period of time, so you can actually transmit them to other people without realizing. So it's a big deal. On here, she put lesbians are at equal risk. Well, everyone's at equal risk for a sexually transmitted infection. I know a lot of older adults don't even think about sexually transmitted infections, so they may not use condoms or whatever because of that. But, like back when we talk about HIV and AIDS, that's on the rise with older adults because of that kind of thinking. So with sexually transmitted infections, it's definitely a good idea to use condoms for everyone. And here, I think these statistics are a little bit old, so it's probably different by now. This is talking about the state of STDs in the United States. This is from 2017. So they're just saying that like chlamydia and gonorrhea and syphilis are actually going up, since 2013, to 2017, which is not a good thing. Hopefully, like public health officials kind of get that out there about using condoms as like a super important thing to do. And then she just has a list of some of the things that are considered sexually transmitted infections. Okay, this chart here, this again lists some of these infections on the left-hand side, but it also talks about how long before the symptoms appear. So like with gonorrhea, it could be 2 to 30 days. So this person might not know they have this, and within those 30 days, they could have sex with someone else and spread it. And then look at syphilis, 10 to 90 days. So there's a lot of differences with some of these infections, but that's the bad thing. It can be very tricky. If you don't get treated, it can cause huge problems for other people. Also, some of the stuff she was saying, she said that men become aware of their symptoms before women do usually. So women usually are at higher risk for STDs. they can affect the baby and get them infected. So if this woman is pregnant and she gets an STD, it can cause problems for the baby. And I don't know if you notice here, but there are some of these things that are bacterial and some that are viral. So, the treatment is different depending on if it's bacterial or viral. So you can't just give an antibiotic for everything. But obviously the main concern with STDs or STIs is to prevent them from occurring altogether. So again, condoms are really important to use. The next thing that she has here has to do with gliomas of the uterus. So what a glioma is it's a fibroid tumor. These can be pretty common. Like I know my sister has had this happen. And then sometimes people are asymptomatic and sometimes they're not. Sometimes you have lots of pain from them. So blood loss can cause this person to have anemia. Usually you get lots of bloating, you have really heavy periods from this, and you can get abdominal pain. So she used to have all of that. So she went through a lot. She went through a long period of time where they couldn't figure out what was wrong, and finally they figured out it was this. And then once she had surgery to remove all of this, she was so much better. So yeah, so this is a big deal for a lot of people. So in this picture, it's showing some of these fibroids. So sometimes they grow more during pregnancy. So if someone has these, it could turn into be a big deal. They can be in the uterus, they can be in uterine muscle, and they can also be outside attached to the uterus. And it can make it really problematic to maintain a pregnancy if someone has this. So typically treatment for this would be hormone treatments. And Depo-Provera is one of the medications that they use, and it's useful in shrinking the fibroids to get them to be small. And then as far as risk factors for this, usually it's people who got their period really early on in life. It can pass down from family members. So if a mother or sister has it, you're more likely to get it. Apparently it's more common in Black women and also people who are obese. And then also if you have a vitamin D deficiency, this can also cause you to be more at risk for this. So fibroid tumors of the uterus are called gliomas. All right, another thing she hits on in here is cervical and pelvic cancers. So cervical cancer rates are decreasing, which is great. Although, it still is a problem. There's still people who get it. So with cervical cancer, people need to be getting their annual exams. They need to be doing this yearly. There's a lot of people out there who don't even do that, which is crazy. But pap smears are, something that they used to say you had to get one every year, but now they say you can get them every 3 years if you haven't had any abnormal readings in the past with your tests. So every 3 years is what people should be doing to kind of, help prevent cervical cancer. And then she mentions endometrial cancer there, and then also ovarian. So ovarian cancer symptoms are really difficult to diagnose. Sometimes you'll see people who have lots of bloating, their ovaries are being, so honestly, like you should go for your annual, checkup every year. And then during that, when they're trying to look at all of those areas, ovaries, they need to be palpated. So they should be the size of a walnut. So they should be real small. And I guess they should be smooth as well. So if they have like a bunch of bumps or something on them, that's a problem. If you did see that there was an issue when the physician was doing this test on you, they may need to be diagnosed by a biopsy. So they may have to end up doing a biopsy to see if that's what's going on. All right, she also put in some stuff here about breast disorders. So obviously, there's a lot of different screening tools out there that we can use to help with this. But mammograms are very important to get. So mammograms should be done by age 40 unless you have a family history of breast cancer in your family, and then your doctor would probably want you to do it earlier. So obviously we want people to do self-breast exams as well. That's really important to do here. So that would be something that we need to really promote with our patients. All right, she has different kinds of treatments that you could do for breast cancer here. So there is a lumpectomy, which would be where, maybe they decide that your cancer is just really in a small area and they could just take the lump out itself and that's it. This actually conserves the rest of your breast tissue, so you just have that piece of it taken out. Then the mastectomy is all of the breast tissue is removed along with the lymph nodes that might be, affected. And then of course, there's radiation and chemo that people could do if they had to. And then they also have hormone therapy. My mom is on a hormone therapy she has to take for 5 years because she had breast cancer a few years ago. And it's just a pill that she has to take, and that's all it is. So once a day, and she's good. So the first, when they figure out that you have breast cancer, first, they do the mammogram, and they might see it on there. Hopefully they would, And then if they see something worrisome, then they're going to tell you to go for an ultrasound. Then after the ultrasound, they would probably move on to a biopsy. And this will tell if the tumor is cancerous or not. So, and then this lady from Wisconsin was saying that there's also this other kind of testing, which I was not aware of this, but she says it's ONCA testing. And this tests the tumor itself, and it will tell us if chemo is effective for that type of tumor or not, which is kind of nice because certain tumors aren't, the stuff doesn't work for certain types of cancers, right? And so it'd be nice to know ahead of time so you don't waste your time on doing chemo if it's not going to be effective, So I thought that was pretty cool that there is some type of testing that will tell you that. This is just like telling you kind of what they do when with breast cancer. So like, most people, they have normal results of their mammograms, right? So they do the screening mammogram. If they have normal results, usually that's about 90% of people. So they just, next year they come back to another mammogram. If they don't have a normal mammogram, usually this is only about 10% of people. So they might see some type of changes or whatever. So then they would do some more workup. So they might, send them for an ultrasound or do a little bit more. Then about 25% of those people have changes that indicate a need for additional testing. So then maybe they would say, okay, I need to do a breast biopsy. And then from there, 20% of those people may actually have cancer. So, of those people, 20% could be late stage and then 80% might be early stage. So like for my mom, when she had this, hers was found through a mammogram, and she eventually had to get the ultrasound and then did the biopsy. And then they ended up doing, so then they found out that she had early stage cancer, and her stage was stage 0, which I don't know if you guys realize, but there's actually a stage 0 here. So they ended up just, doing surgery. So she was able to get that part of her, so she had a lumpectomy basically. So they took that part of the cancer out, and then she ended up having to get radiation to that area for so many times, and then she had to do the hormone therapy for 5 years, and then she was good. So on this slide, this talks about the different stages. So obviously stage 0 is better than stage 4, right? So typically you have a really good survival rate, and usually the cancer itself is very small and it's not in your lymph nodes. So these survival rates are after treatment. All right, and then stage 1 would mean that the tumor is probably about 2 centimeters or so, and there's no lymph nodes involved. Stage 2 would mean that maybe the tumor's a little bit bigger. It might be greater than 2 centimeters. Still no lymph node involvement. Stage 3, now you may have some lymph nodes that are affected. And then stage 4 usually means that this cancer has metastasized to other places. It's got into your lymph system and it moved to other places as well. So now your survival is not as good. Okay, so then the last part of all of this talks about intimate partner violence. So obviously this could be physical, sexual, or psychological. And there's a lot of different risk factors of why people do this, you know. But violence in pregnancy is a big deal. So during pregnancy, abuse tends to escalate. You would think that maybe the abuser would think, oh yeah, this person's pregnant, I wouldn't want to hit them, but it gets worse. So the person who hits them usually will actually aim at their abdomen and try to hurt the baby as well. So it gets pretty bad. She put on here, 1 billion women in the world today will be victims of violence. That's 1 in 3. So way too many people, definitely. And then she has some other kind of weird things on here, but she put a historical perspective on violence against women. So back, years and years ago in Rome, they actually condoned divorce or killing of one's wife for offenses. So if a husband and wife had some kind of disagreement, they would usually go with the husband and say he was okay to kill his wife. And this was like the rule of thumb back then. And then, in the 1800s, men slowly lost the legal right to beat their wives. So then it wasn't, okay to do that anymore. Then not until 1971 was the first women's shelter opened in London. So isn't that crazy? All of that time, there's all of this violence that was happening. And not till 1971 did we finally see that there was an issue that we needed to do something. And she put in her stuff that she had done her voiceover on that, 1971, we have this shelter open in London, but the first animal shelter was opened in 1940. So that's kind of a shame. We were more worried about animals than we were about actual people with this. Okay, so then 1979, the first description of a battered woman syndrome was, came about. In 1994, we had our first SANE program started. So SANE stands for Sexual Assault Nurse Examiner. So typically, if someone comes into the ER and they, have some type of sexual assault done on them, then you usually have this SANE person that comes to do the examination of them. 1996, we had our first violence hotline, and then 2015, we finally see our first safe rooms. So this is supposed to be the cycle of violence. So what she was saying on her stuff, she said, usually when people are abusers, usually it's because they have the lack of the ability to handle tension in a situation. So when you're in a relationship with someone, whether you're married or not, there's always going to be tension at different times. And if you're mature enough and you've had people, hopefully you've had people in your life to teach you how to deal with things better, then you handle it better, right? But usually these are people who have the lack of ability to handle these tension situations. So this tension just escalates in the relationship, and then something stupid will happen and it will cause this violent outbreak. So maybe, the woman serves the guy something he didn't want for dinner or something, and so then he starts to beat her. So this, this happens, you get this violence that happens, and then you go into that honeymoon phase. And the honeymoon phase usually is where the abuser is really sorry that they did all this. They're actually sorry. And, there's still some tension in the relationship in this phase. And, they just try to convince, the person that they abuse that they're sorry, that they won't do it again, and it's never going to happen again. And this just keeps going on and on and on. So again, if you have good people in your life to teach you how to deal with things, if you have good parents to teach you, how to do things the right way, then hopefully this doesn't happen to you. But there's people who handle tension in the wrong ways, so they may handle it, by doing violence, they may handle it by drinking, they may handle it by doing other things. So that's kind of the cycle of violence here. So then this talks about intimate partner violence. So she says here, intimate partner violence is the actual or threatened physical, sexual, psychological, or emotional abuse by a spouse, ex-spouse, boyfriend, girlfriend, ex-boyfriend, ex-girlfriend, date, or cohabiting partner. It doesn't have to be an intimate partner like a sexual partner. It could be a roommate even. And then it says, when is one of the most dangerous times for those experiencing intimate partner violence? So typically it's when they decide to leave. So it's between the woman's decision to leave and when they leave is when that's the most dangerous time. So for us as nurses, it's really important that when we see patients that we are suspecting abuse with, that we ask and be really specific about the questions that we ask. So instead of just saying, hey, do you feel safe at home? Ask things like, have you ever been punched, kicked, or hit by your partner? Have you been forced to have sex when you didn't want it? And, things like that, just be more specific so that you can get to the root of what's going on. Because if you just are real vague, people won't come out and say anything to you. So we also need to watch for nonverbal cues, by our patients. And then when we document about this stuff, we need to document like really good. Because this person could potentially go to court, And so if your charting goes to court, you need to be really specific about what you saw and what you asked and what you did. We need to take care of this person's physical injuries. And then, so she talked about on her thing that this is kind of an ethical dilemma. So in her state, in Wisconsin, intimate partner violence during pregnancy is not something that's mandated to report. So you would think, how we always talk about violence and abuse here, we say if you see a child that's abused, you're mandated to report that. If you see an older adult who's abused, you're mandated to report that. But in her state, that's not a mandate. So they don't consider that a problem. So I thought that was kind of interesting. So I don't know, it must differ from state to state with how that is taken into account. Okay, so on here it talks about pregnancy is not a protection against intimate partner violence. Sometimes it makes it worse. Intimate partner violence can begin for the first time in pregnancy. It's usually greatest in the first trimester. And then also teens are subject to higher rates of intimate partner violence than older women. So that's kind of a big deal. So I don't know, that would be kind of an interesting, public health thing to take into account. That's sad that that's even the case. Intimate partner violence has detrimental effects on the fetus in pregnancy, of course, because that could cause, the person to miscarry. Okay, she has a video here, and I'm not sure if you're going to be able to hear it or not. So I'm going to try it and see if you can hear it. I think it has Um, can you guys hear that or no?
No.
No, figures, darn it. I don't know what the deal is with videos. I can't get people to hear them on here. So anyway, look this up and then maybe you can watch this. There's a thing on YouTube called Tea and Consent that has to do with sexual violence, honestly. It's just a real short little thing, like 2 minutes or whatever. But that's what she has here. And so then the last part, she talks about sexual violence and long-term effects. So with behavioral things, you know, if someone has had sexual violence done against them, some of the things you might see would be things like self-harming, suicidal ideation, and cutting. They might withdraw from their family and their social life. They may have some angry outbursts or unexplained mood changes or mood swings. They may just feel like they have a really low self-worth. And then physical things, you could see, you could see things like gynecological disorders, anal or vaginal prolapse, um, fistulas, endometriosis, all these things. And then I thought this was kind of interesting. This lady from Wisconsin that does this stuff, she's an actual midwife, and she was saying that she noticed that in her practice when she delivers for people, if there's someone who has had sexual violence done against them, it seems like they act differently compared to other women who are giving birth. Like they seem to have more pain during labor. Um, so she says that it's very beneficial to have them have an epidural kind of early on because they tend to deal with labor better. It's almost like their pain is associated with that sexual stuff that happened to them in the past. It's just different. And then with cognitive long-term effects, you can have PTSD, depression, um, anxiety disorders, and you name it. So a lot of bad things can happen from sexual violence. And then, so just to wrap up in here, the big thing that I really want you to focus on out of this chapter would be the sexual violence stuff and like things that you need to ask someone to figure out if that's happening to them, because there's a specific question on your test about that. All right. So looking at the test, I didn't really see, in the other two chapters that there's a ton of stuff off of there on your test. So that's why I chose this chapter instead. When it gets a little bit closer to time, I will do a hey, things to know for the test for you. I'll send that to you so you can get ready. But yeah, so just make sure you're keeping up with the reading and looking at everything still, even if you don't think it's going to be on the test or whatever. It's still important to know this stuff. Because remember, you will have that OB proctored test, and a lot of the stuff could be on there as well. So just make sure you're paying attention to those things. Okay, so I'm going to end here. I've been recording everything, so I'll post these on your page as well, so you can relook at it later if you want to. Remember, next week when we come, Dr. Silva will be here. I'm not sure what time she's going to lecture yet, so I'll get back to you on that if we do change a time for some reason, because she's nice enough to come, so I told her she could, do it whatever time she wanted in the morning here. So I'll get back to you about time. Any questions about anything? Make sure that every week you're getting into the discussion board and doing stuff on there too. I saw a bunch of you did that today, so that's fine. I'll try to, post some stuff back to you in there as well. But, you know, I have a time that you do it towards the beginning of the week and then a time you do it towards the end of the week. So make sure you're getting in there twice every week. That's just part of your participation in the class. So that kind of helps me with attendance and everything too. Okay. All right, so for our next class, we're going to meet at 12:30. So everyone can go eat now and everything, and then I'll see you back here at 12:30. Okay?
Okay, sounds good.
All right, I'll see you shortly.
When do you want me to take that math test? Like the next one?
What's that?
When do you want me to take the math test for the next class?
Oh, let's do this. So, did you want to just do what we did for the last class? You come at like 12 or something and start?
Yeah, I can do that.
Okay, that's fine. Let's just do that.
Okay. Okay.